So vision disorders are the fourth most common disability overall in the United States, and it's the most prevalent handicapping condition for children. In 2006, there was an analysis of over 1,000 infants done, and they were checking to see if these children, aged 0 to 12 months old, had any kind of visual risk factors. A visual risk factor is considered something in the eye or in the visual system that either requires careful follow-up or it requires treatment. So in these 1,000 infants, 17% of these children had a positive risk factor, so something that either needed to be followed carefully or something that required treatment. And if the child was premature, was a minority, or had a low family income, then that increased to 25%. The issue here is a lot of these risk factors don't have any signs, so the parents themselves, you the parents, are not able to actually see that there's something wrong with the child's eyes or with their visual system, or they have no symptoms, or if they do have symptoms, the children don't actually complain of anything because they don't know to complain. This is how they've been seeing, how they've been experiencing the visual world for their whole entire life, so they don't know that you're not supposed to see double after reading. You're not supposed to be getting a headache after you do your homework for 5-10 minutes. The words are not supposed to move when you're trying to read. They don't know that not everyone sees this way, so they just deal with it. For children age 6 and below, it's estimated that 10% of these children, so 1 in 10 children, has a risk factor for an undiagnosed eye or vision problem. But given all of this information, studies are showing that only 13% of parents actually make sure that the child receives a comprehensive eye evaluation by an eye doctor. The issue here being is that if some of these conditions are left untreated, they're left unfound, then this can lead to difficulties in their development, in their education, and for some of these things, possibly permanent vision loss. So it's very, very important that parents start bringing their children in, not for vision screenings, but for an actual comprehensive eye exam by an eye doctor. In terms of academic learning, why is vision important? So 80% of our understanding of the world, of our learning, comes through our vision. If we think about what happens before 3rd grade. So before 3rd grade, our children are being taught how to read and how to write. They're being taught their alphabet, they're being taught their sight words, and how to get visual information from the text. At 3rd grade and on, they're actually using the reading to learn. So they're getting homework to read a chapter in a textbook. They're getting homework to just read a book, or they have to read things off of the board. And then they're getting quizzed and tested on that information that they have read. So if they're having visual problems that are affecting their ability to read and to learn, that is going to affect their ability to perform in school. If we take a look at what a common vision screening does, so the vision screenings that are done at a pediatrician's office or the vision screenings that are done at the school nurse's office, these screenings will usually check what the child sees at distance, how well they see far away, which is great. That is very important. If a child can't see far away, we need to know that and we need to be able to address it. But all that is catching are children that have nearsightedness, children that have a very high amount of farsightedness, or children that have a very high amount of astigmatism. So everything else that we're going to discuss today, children are going to pass a vision screening, and that is a very big issue because those things are going to affect their academic ability very significantly. If we take a look at what's recommended by the American Optometric Association, they recommend that a child has a comprehensive ocular and visual evaluation by an eye doctor at the age of 6 months. 6 months old is when the child should be having their very first eye exam by an eye doctor. And then if everything is okay, then when they're 3 years old, before they start school, and then every 2 years after that, unless there's an issue that the doctor says needs to be followed more closely. The reason we say 6 months old is because at the age of 6 months, the child's visual system is either at or very close to where it's supposed to be for an adult. So first of all, we're trained to evaluate a child at 6 months old, we have equipment, we have special training to be able to check what their vision is, if they have a prescription, how the eyes are working together, what their focusing system is like, what their eye teaming and eye tracking system is like. We can do all of this without the child having to say a single word. And the sooner we find a problem, the easier it's going to be to treat the problem and the better results we're going to get from treatment. So we really should be seeing every single child at the age of 6 months for their very first comprehensive eye examination. And the AOA believes in this so fiercely that they have created the infancy program. So the infancy program was created over a decade ago, and it is a program where optometrists that are part of this program pledge to do a free, totally free of charge, comprehensive eye exam for a first-time exam for children that are between the age of 6 months to 12 months. So if you go to infancy.org and you put in your zip code, you can find a doctor in your area that participates in this program. Mention the infancy program when you call in to make your appointment, and the doctor will see the child and they'll do a full comprehensive evaluation free of charge. So what is it that we're looking for when a child is brought in, no matter if it's a 6-month-old or if it's a 12-year-old? What is it that we're actually looking for during the evaluation? We use high-yield tests to find high-risk and treatable conditions. And if there is something discovered, then depending on what it is, we might just leave it alone and watch it, because sometimes things will get better on their own. We might say that we need to monitor it very closely, or we might need to treat. So it really depends on what the condition is. So what is it that we talk about when you talk about good vision? Is 20/20 vision enough? So when we talk about good vision, we have to be able to take good incoming visual information. We need to be able to process that information, and then we need to be able to obtain meaning from that information. So no, just having 20/20 vision at distance in each eye individually is not enough to say that someone has good vision. When we talk about having good incoming visual information, what does that include? What do we need to have for that? So first, we need to be sure that the vision is clear at distance. We're able to see at distance. That's where the 20/20 comes in. But we also need to be able to see clearly at near. So to be able to see clearly at near, we have to have a good, healthy focusing system. So just like when you're using your phone and you're trying to take a picture and things are blurry on the screen and you have to push the screen to make sure that things get focused in so that things are clear, we have the same thing inside of our eye. We have a focusing system inside of our eye. So that focusing system needs to be working properly to focus things up close. Our eyes need to be working well together. So we need to be able to have our eyes pointing at the same place at the same time, no matter if we're looking far away or up close, so that we don't see double. And then we need to be able to have a healthy tracking system. So either being able to follow an object as it slowly moves from side to side or up or down, or being able to jump from one place to another accurately. So we need all of that to have good incoming visual information. What about if we just take a look at academics? So for fluent reading, to be able to read fluently, we need to be able to focus on the page and make things clear. We need to be able to comfortably keep that focusing system focused at near for a long period of time. We need to be able to coordinate the eyes so they work together, point at the same place at the same time comfortably for a long period of time. Being able to jump quickly and accurately from one word to another, as well as from the end of the page to the start of the next page, the next line. And then we need to be able to interpret, process, decode everything that is read, and gain meaning from it. So all of this needs to happen for us to be able to fluently and comfortably read and get information out of what it is that we're reading. So if you take a look at this screen here, a child that has a problem with their focusing system, with their eye teaming system, with their tracking system, slightly blurry vision, all of these children are going to be missed by a standard vision screening. They're going to pass a vision screening, and they're going to think that their eyes are perfectly healthy. The parents are going to think, well, my child got a vision screening, and the vision screening said that their vision is okay. And so if the child is struggling in school, the parent will think that it's not related to their eyes, the child will think that it's not related to their eyes, and then they will not ever find out what the problem is. Or it'll take a long time for them to actually find out what the problem is and get treatment for it. So what do we do? What is it exactly that we're looking for when we're doing a comprehensive pediatric eye exam? So these are the things that we're really looking at. We're looking to make sure that there's no lazy eye or amblyopia. We're looking to make sure that the eyes are working well together and that there's no cross eye. We're looking for any farsightedness, nearsightedness, or astigmatism. Making sure that the focusing system or accommodative system is working, making sure that the eye tracking or ocular motor system is working, and making sure that the eyes themselves are nice and healthy. So who are the children that are at most risk for developing one or more of these issues that we're going to be talking about? So these are children that have a difficult or an assisted labor, associated distress, or a low APGAR score, anyone with a low birth weight or use of oxygen when they were born, any kind of drug or alcohol use during pregnancy or sexually transmitted diseases in the mom, any kind of brain injury or trauma during the birth or right after birth. Also, children that have developmental delays, Down syndrome, autism, cerebral palsy, any children that have a family history of eye disease, such as cataracts, glaucoma, or any kind of genetic diseases, and also family history of any kind of high refractive error or need for glasses, cross-eye or lazy eye. Those children especially should be brought in sooner rather than later, but again, all children should be having a comprehensive eye exam. So when they do come in, we're going to be taking a comprehensive detailed history of their birth, development, medical and family history. We're going to check their need for glasses in each eye individually and how the two eyes work together, their focusing, their tracking system, both at distance and at near, and also evaluating how well the health of the eye is. One of the most important things that we go over with the parents and the children is their symptom history. So these are questions that the child has probably never been asked, and these are very, very important questions to ask every child that's in school, and specifically children that are struggling in school, to try to figure out if their struggles are related to their vision. So do they have blurry vision at distance? This is the question that they're usually asked by parents, by pediatricians, and by school nurses. And this is, again, a very important question, but this is one of many questions that need to be asked and need to be addressed. So we also need to know, do they have blurry vision at near when they're reading? What about if they read for a long period of time and then they look far away? Do things far away look blurry after they look up from doing near work? Do they have a pain around their eyes, a headache in the front of their head, nausea, dizziness after they're reading or doing near work? Do they have double vision, or do the words move around on the page when they're trying to read? Does your child ever close an eye or lean over so that they're slouching so that they're only looking through one eye when they're trying to read? Is there difficulty copying from the board at school? When the child is reading or looking at something up close, do the words run together? Do the words move, jump? Do they swim together when the child is reading? Do they skip words and lines? Do they have to go back and reread? Do they omit words when they're reading? What about reversal of letters or reversal of numbers when they're reading or when they're writing? Is there any trouble understanding or remembering what they're reading? And are they able to understand instructions better if someone says it to them verbally as opposed to if they have to read those instructions on their own? So these are very important questions to go through with any child, but especially children that are having problems in school. And if the answer to any of these is yes, they definitely need to be brought in for a comprehensive eye exam. And you'll be very surprised how often I'll have someone bring their child in and the child is struggling in school. This is their very first eye exam. And I'll start asking them these questions and they'll start answering yes. And the parents, open their mouth and they're dumbfounded saying, well, why did you never tell me? And again, the children don't know that this is not normal, that this is not okay. So the response for the child is, you never asked. So if the child is never asked, then they don't know to tell you. So now what we're going to do is just dive in right into the things that we're going to be evaluating when you bring your child in for their evaluation. One of the first things we look for is to make sure that the child doesn't have a lazy eye or amblyopia. So lazy eye is when you have a total loss or just a lack of the development of their central, clear, detailed vision, but the eye itself is healthy. This happens because there's not a proper connection that forms between the eye and the brain. So when a child is first born, their visual system isn't fully developed. So they use the visual information that they get from the world, they use their vision to actually finalize and form that connection between the eye and the brain. So if they have a high prescription and their vision is blurry, or if they have a cross eye, then that connection between the eye and the brain isn't going to form properly. So as the child gets older, once they come in and we put glasses on, even with glasses on, their vision doesn't get to a perfect sharp 20/20 because that connection was never properly formed. This happens anywhere from 2 to 6% of the population. It could happen in one eye or both. And the sooner we treat this, the better. And treatment for this is usually a combination of glasses as well as vision therapy. So a child with amblyopia will, this is an example of what they might be seeing. So we have one eye that's seeing clearly, but the other eye that's seeing blurry. So because a child will walk around with two eyes open, they're never going to complain that their vision is blurry, because what's going to happen is they're going to ignore the vision from the blurry eye and just use their good eye to be able to see. So what these children will usually do during a vision screening is they will look at the chart with their good eye, they'll read it, they'll memorize what it is that they read, and then they'll cover their good eye. And even though they can't see the chart with their bad eye, they'll just memorize and recall what it is that they said initially, and so they will pass vision screenings a lot of the time. Even if these children put glasses on and were able to get the vision down to 20/20 in the lazy eye, it's still a good idea to do a vision therapy evaluation for these children, because aside from just poor vision, a lot of times these children will also develop problems with their eye tracking, eye teaming, and their focusing system. So it's good to have a vision therapy evaluation for any child that has a diagnosis of a lazy eye. The other one is cross-eye. So cross-eye happens when the two eyes don't point at the same place at the same time, so the two eyes are not looking at the same object at the same time. So here the child could either be seeing double, so two separate images, or what could happen is the eye that's turning in or the eye that's turning out, the brain will just shut off the visual information coming in from that eye, so it doesn't have to deal with the whole issue of seeing double. This happens in anywhere from 4 to 6% of the population. It could be in one eye, in both eyes, it could be all the time, it could be just sometimes, and depending on if the eye is turning in and turning out, depending how big the turn is, and depending on how frequently the turn happens, this can be treated by a combination of glasses, a vision therapy, and or surgery, depending on what the condition is. Convergence insufficiency is another part of an inability of the eyes to work together. So what happens is the eyes look straight when you're looking at the eyes. But what happens is when we are looking far away across the room, the eyes will be parallel to each other, right? They'll be looking straight ahead. The closer something comes to us, the eyes have to be able to turn in so that they're looking at the same place at the same time. So convergence insufficiency happens when someone starts to bring an object closer and the two eyes will not be able to look at that one object at close up. So one eye will either turn out or the brain will just totally shut off the vision from that eye so that they don't see double. And these are children that will have a lot of headaches and eye strain and discomfort when they're trying to read. So if a child is having eye teaming problems, so either a cross-eye or convergence insufficiency, this is an example of what they will be seeing. So words will be moving on the page, they'll be seeing double. A lot of times you'll see a child just closing one eye so that the two eyes are not working well together. So if we just close off one of the eyes, then we don't have to have the eyes work together and the symptoms go away. So these children will slouch, or they'll move over and close one eye when they're reading so that they take these symptoms away for themselves. These children will pass a vision screening because vision screenings don't evaluate how the two eyes work together. You close one eye, you read the distance chart. You close the other eye, you read the distance chart. We never evaluate how are the two eyes working together, especially when you're looking up close and trying to read. Eye tracking or ocular motor dysfunction. This happens when a child has an inability to either accurately jump from one target to another or to smoothly follow something that's moving around. So if we take a look over here, this is an example of a child without any eye tracking issues trying to read. So the circles are when they take a pause, the lines are when they make a jump to the next pause, and then the arrows are when they jump back to take a look over here. So the bigger the circle is, the longer their pause is that they're making. So take a look at this child that doesn't have any eye tracking issues at all. They're very smoothly jumping from one word to another, taking in the visual information and moving on. So here we have a child that has an ocular motor dysfunction or eye tracking dysfunction. So you can see that there are many more jumps. The jumps are much more erratic, jumping back and forth. The larger circles are telling us that he's pausing for a much longer period of time. So this is a child that is reading, a child that has an ocular motor dysfunction. So this is something that cannot be treated with glasses, cannot be treated with surgery. So the only thing that will actually help this is vision therapy. So again, this has nothing to do with their ability to see. This has to do with how well the eyes are able to jump from one target to the other, how well the brain is controlling the eyes. So these children could have 20/20 vision far away, they could have 20/20 vision up close, they could have good eye teaming skills, they could have good eye focusing skills. This has nothing to do with any of those. This is a standalone problem, and again, that's not evaluated during a vision screening, and these children will pass a vision screening evaluation. So I'm just going to take a second and have you start here and read following the arrows. So this is what it feels like for a child with an ocular motor dysfunction to try to read. So you are concentrating very hard on actually reading the words, on figuring out where it is you're supposed to go so that you don't get lost in the page, so that you are reading everything in order, in the right order that you're supposed to, and you're keeping your eyes moving in the proper direction. So as you're trying to read, you're paying so much attention to what it is that you're trying to read that it's very hard for you to actually make sense of what you're reading and get visual information and use that information later on, because all of your energy is concentrated on just making sure you get the words. So this is what it feels like for a child with an ocular motor dysfunction to be doing their homework. So these children are going to be very, very frustrated. They're going to have a lot of omissions, a lot of rereads, a lot of difficulty understanding what they're reading. They're also going to be having a lot of difficulty in math, a lot of difficulty copying from the board, putting the decimal point in the right place. So these children are going to be all over the place. The other thing that we look for is the need for glasses. So first, let's just go over what a person that doesn't need glasses sees like, how that looks. So if a person that doesn't need glasses is looking far away, so this is not talking about up close, we're just talking about you looking across the room. So the light comes into the eye, it goes through the pupil. This is where you have the little dark opening in the center of the color part of the eye. It goes through the lens. The lens here, let's remember that because that's going to come back. We're going to be talking about this. and the light comes in and it hits the macula, the back of the eye. This is that center that we use for that bright, sharp, clear 20/20 vision. So things focus here, and then from here, the information goes to the back of the brain to get processed. So someone that doesn't need glasses, information from far away comes in, goes and focuses right onto the eye, and you have clear, good 20/20 vision. When we have someone that is farsighted, what happens is when they're looking far away, the information comes in, but instead of focusing right on the back of the eye, it will focus behind the eye. So let's go back to this lens, this focusing system that we talked about. So this lens starts off at 0. So the power is 0. It's not being used at all when someone is looking far away. But if the image falls behind the eye, or if someone is looking up close, what can happen is the lens will start to increase its power. As the lens increases its power, it moves the image back onto the eye so that this person can see. So someone that has a low or moderate amount of farsightedness is able to use their focusing system, if their focusing system is healthy, and bring that image to the eye, to the center of the eye, and get it focused so that they're able to see without having to use any glasses for far away. What happens when they're looking up close? So as something comes closer, as this object comes closer, this image also moves further away. So the object moves to the right, the image moves to the right. So what happens to the focusing system? The focusing system now has to increase its power even more, work even harder, do more focusing to bring that image back to get focused onto the eye. So if it's a low or a moderate amount of farsightedness, and if the focusing system is healthy, then again, that's not too much of a problem. But if there's a difficulty with the focusing system, or if it's a moderate to high amount of farsightedness, then when the child is looking, especially up close, they're going to start having a lot of fatigue, a lot of discomfort with their reading, because they're constantly having to overstress and overwork their focusing system. So what about for nearsightedness? Nearsightedness works the opposite way. So you have an object that's far away, the information comes in, and it will actually focus in front of the eye. So the thing with the focusing system is that it can increase its power, but it can't actually decrease its power past 0. So when someone's looking far away, the lens's power is at 0. So there's no way for the lens to move this image from being in front of the eye to going back. So these children will see things blurry when they're looking far away. And these are the children that are caught during normal vision screening procedures. When the object moves closer, so when they're looking at something closer, so the object moves closer to the eye, this image will move this way again. So depending on where it is, how far it is that they're looking, the image will either focus right on the eye or it'll focus behind. And again, if their visual system, if their accommodative system is working well, then they'll be able to bring the focus back onto the eye and be able to see things clearly up close. And that's why farsighted kids might not need to wear glasses for looking up close. They'll just need them for looking far away. Astigmatism is when there is a change in the shape of the cornea, the front part of the eye. So we have the cornea that is a clear tissue that sits in front of the iris, the colored part of the eye. Normally, the cornea is shaped like a sphere, like a soccer ball. Okay, it's perfectly spherical. Sometimes what can happen, and this is not any kind of a disease or any kind of a pathology, this is just something that happens in the normal population. The cornea can start to look more like a cone. So instead of being perfectly spherical, it looks more like a football instead of a soccer ball. So what that means for us is that when a child is looking at any distance, doesn't matter where they're looking, far away or up close, they will always have the image focusing in two different areas. Instead of focusing in one place at the back of the eye, they will have the image focusing in two different areas. And so what that means is when we're making glasses or when we're making contacts, in front of that one eye, we need two different prescriptions to be able to make the vision clear. The last thing we're going to talk about in terms of need for glasses is the focusing system. So we already reviewed how the focusing system works. When someone is looking far away, the focusing system is totally relaxed. The closer something comes, the focusing system has to increase its power to get the image to actually focus right on the eye. So if the focusing system is not working well in terms of its ability to actually perform its focusing duties, or if it doesn't have enough stamina, so if it tires out very quickly, the child is going to start having a lot of difficulties with reading because they will either have a difficulty with seeing what is written in their textbooks, or they will start getting a headache because they're overstraining their focusing system, or the vision will go in and out of blur consistently because their focusing system is starting to tire out. And these are the children that after they read for a little bit, they will look far away and everything is blurry far away because their focusing system has gone into a kind of spasm. So again, these are children that will pass a normal standard vision screening. And this is what it might seem like for a child with an accommodative issue to read. So either they'll always see this way, or the vision will go in and out of blur as they're trying to read. So all of these things, the majority of these things, except for children that have nearsightedness or have a high amount of farsightedness and a high amount of astigmatism, these are all children that are going to pass a standard vision screening, and they're going to have issues with their academic work. This is what it looks like for them to be able to read, to be able to do their homework, to do anything up close. And if these issues are not caught, then these children are going to have to struggle through their academic work, or they're just going to stop doing it altogether, because who would want to read when things look like this? And it's not only their academic world that becomes affected with all of these issues. So if someone has focusing, eye teaming, eye tracking issues, or poor vision, it's going to affect their whole entire life, their ability to do sports, their ability to interact with the world. This is all going to be affected. The other part that we also look at is the visual perceptual process. So say their eyes are perfectly healthy, they're able to see well, they're able to focus well, they track well, their eyes work together very well, everything is fine, but they're still struggling in school. This could mean that they have a visual perceptual problem. So visual perception is looking at how well does the child process the information that they receive through their eyes, and how well are they able to use that information and to actually interact with the world. So a child that has visual perceptual issues, so again, visual perception is totally separate from vision and tracking and focusing and teaming. They could have problems with one or with all of these, and they're all independent of each other. So a child that has visual perceptual issues could be confusing their shapes, colors, objects. They could have difficulty telling the difference between different objects and sizes. They could have difficulty finding a piece of information from a page. So if they're looking for a specific detail in a paragraph, they get lost in the page. They mistake words with similar beginnings like they and them. Their reading is slow and disjointed. They have problems with reading comprehension, learning the alphabet, recalling what is read with phonetic reading, sight words, and spelling. They have a big difficulty with looking at any kind of graphs and charts. They confuse their right and left, have difficulties coordination and balance, with sports, with puzzles, with cutting, with tying their shoes. So all of this comes into play for children with a visual perceptual dysfunction. And then lastly, we look at ocular disease. So thankfully, ocular disease is not very common in the pediatric population, but whenever a child comes in for their very first eye exam, we always make sure to do a full evaluation, a thorough evaluation of their ocular health to make sure that they don't have anything that needs to be evaluated or treated in terms of the health of the eye. So what if we do find a problem? What if we do discover that the child needs glasses or that they have a tracking issue? What are we going to do with them? Depending on what the issue is, depending on what we find, we might say that, okay, this is normal for this age group, this is normal for your child, let's just monitor and see what happens. We could do glasses. We could do treatment with medication. If we need to do surgery, we'll refer over for surgery. For things like tracking, visual perception, eye teaming, lazy eye, cross eye tracking, that's where vision therapy comes into play. So just like speech therapy, occupational therapy, physical therapy, we work with the child both in the office and at home to make sure to get their visual system back to a healthy level where they can start using their eyes appropriately to be able to get them through what they need to get through in school and in their overall general activities. So only a comprehensive eye exam by an eye doctor, either an optometrist or an ophthalmologist, is going to fully identify eye problems, give you a diagnosis, give you a treatment plan for the things that may be affecting your child's development and their educational milestones. And there have been studies done showing that even the most highly trained screenings with the top of the line screening equipment will miss 1/3 of learning related eye and vision problems in children. And then once these children get screened and the child and the parents themselves think that it's not a problem with the eyes, it's not a problem with the visual system, it's a problem with the child, they might be misdirected into an individualized education plan or into a diagnosis such as attention deficit hyperactivity disorder, and there'll be a delay in getting the child the vision care that they need, or they just won't get it at all. So again, if we take a look at this chart, this is going from age, so from newborns to 3-year-olds, and this is looking at the visual function, so the eye tracking, the visual acuity or being able to see clearly, eye teaming, eye focusing. If we take a look at a child that is at 6 months old, either all or the majority of their visual function is at or very close to adult level. So again, we're able to evaluate all of these things when a child is 6 months old. And the sooner we catch a problem, the sooner we can treat it, the better we can treat it. So the children should be coming in for their comprehensive eye exam at 6 months old. And if your child is 6, 7, 8 years old now, and they've never had an eye exam, it's okay. Don't think that you're a bad parent. A lot of parents just don't know to bring their children in for an eye exam. Just make sure you schedule an appointment with an eye doctor to get your child evaluated. And talk to your child and look for yourself and talk to the child to see if they're having any kind of symptoms that are associated with poor vision, with eye teaming, eye focusing, eye tracking, perceptual deficits. And again, if they have any of these issues, please make sure to get them evaluated. Something that most parents don't know is that all insurance companies cover a comprehensive pediatric eye exam by an eye doctor because it is currently an essential health benefit. So all insurance plans, whether they're medical or their vision plans, will cover a comprehensive pediatric eye examination. So a lot of parents don't know that. You could always call your insurance company and just double check and make sure you go to a doctor that takes your insurance plan, but your comprehensive evaluation should be covered for children. And don't forget, for children that are age 6 months to 12 months old, the infancy program provides a totally no charge comprehensive eye exam for their very first eye exam. So you do have a lot of options that are either at no or very low cost. And then something that I always want to remind parents of is making sure that the child gets their regular glasses for their everyday activity. But if your child plays sports, especially any of the high-risk sports here, where they are associated with trauma to the eye. Make sure that you get a separate, specifically made protective pair of eyeglasses for your child. When we make the regular glasses, we make sure that the lens itself is made out of a protected material, of a shatterproof material. So if the lens itself gets hit by a ball or by a stick, it won't shatter and pieces won't get into the eye. But that says nothing for the frame. A lot of the injuries that happen to children wearing regular glasses is due to the frame. Whether it's a metal frame or a plastic frame, the frames are not break-proof. So the child will get hit with a ball, with a stick, or they'll fall, the frame will break, and then the frame itself will cause trauma to the eye, and it could be devastating. So if your child plays any sports, make sure to get a separate pair of glasses. You could get a prescription put into the protective glasses so that they're able to see while they're playing, and you could get these made at most opticals that sell regular glasses. So make sure to talk to your opticians about that. And that's pretty much it. If you want to find a doctor in your area that provides these kinds of comprehensive exams, you could visit the infancy.org website, which is the site for the infancy programs for infants, and they have a lot of information there. The American Optometric Association, AOA.org, as well has a lot of information, as well as a Find a Doctor application. You can go in, you can put in that you're looking for a pediatric doctor, put in your zip code, and it'll give you doctors in your area. And then College of Optometrists and Visual Development. So the covd.org is a website specifically for doctors that do vision therapy, vision rehabilitation, behavioral optometrists. So again, this has a Find a Doctor app that you can visit to get information there.